Good morning, everyone. Good morning, Professor Ramirez. My name is Nayvi Brennan, and today I will be presenting the Deming Cycle, which is also known as the Plan, Do, Study, Act model, and demonstrating how it can be applied in nursing practice to improve quality and patient outcomes. I hope everybody enjoys the presentation. To begin with, let's go ahead and introduce the Deming Cycle. The Deming Cycle is composed of four different steps or four different stages. The first one is going to be plan, then we do, then we study, and then we act. That is going to allow healthcare professionals to test changes, measure results, and refine strategies for better patient care. It reminds me also of the nursing process. I don't know if anybody else sees the similarities, but in the nursing process, as nurses, what do? We assess, we plan, we implement, and we evaluate. So I would say that any nurse can relate to this process. For the first step, which is going to be our planning. In the planning stage, we are going to start by identifying a problem or an area that needs improvement. So for example, if our unit reports frequent medication errors during the night shift, we would set a goal such as maybe reducing errors by 20% over the next 3 months. It would also involve reviewing policies in place and identifying gaps in patient care. During this phase, it is also important to make sure that we are setting realistic goals, and we would also examine how we would track these results. For our next step, we have the do phase, or as we call it in nursing, our implementation phase. This is the phase in which we are going to implement a small-scale intervention in order to address the problem that we have already identified. So for example, in the same scenario that we mentioned earlier before, let's use the same medication error example. We can implement a smart double check system, which is going to be composed of, we probably already do this, let's say scanning the medication and scanning the patient wristband, but we are going to incorporate having a second nurse confirm high alert medications in the EMR system. And then we are going to add a digital fatigue alert prompt. After 4 hours or more into the shift, the EMR system is going to prompt extra confirmation for high alert medications. Obviously, staff will receive training, and then the process is tested in a pilot group, and it will be observed and measured. For our next step is going to be the study step. And this one is going to involve analyzing the results of the intervention that we have already incorporated. We are going to collect data, compare it against the original goal, and determine whether the change led to improvement or not. For instance, we will review the medication error report after 3 months to see if the number of incidents have actually decreased or not. Our next step and final step is going to be the act phase. This is the stage in which decisions are going to be made based on the findings. If the intervention was successful and errors decrease, we could standardize the policy across all shifts and units. If the results were not satisfactory, then adjustments would have to be made, and the cycle will have to restart, continuing the process of improvement. Here's another example in nursing practice, which we can all relate to. So let's say reducing patient falls in a medical surgical unit. In the implementation stage, we might identify the most falls occur during the night shift and set a goal to reduce them by 15%. In the do phase, we would implement hourly rounds and use bed alarms. In the study phase, we would involve monitoring fall rates over a period of 6 weeks. If the intervention proved effective, in the act phase, we would expand hourly rounds across all shifts to sustain improvement. How is the Deming cycle beneficial to nursing? It actually provides multiple benefits. So for example, as prompting evidence-based practice, improving patient safety, It encourages collaboration among staff and supports culture of continuous improvement within healthcare organizations. What are some of the challenges of implementation? One of the main challenges with implementations is always resistance to change. Other challenges are going to include limited resources, time, barriers in data collection, maybe the need for a stronger leadership support to sustain improvement efforts as well. As nurses, we definitely play a significant role when it comes to the Deming Cycle. Obviously, as nurses, we are first line, we are at the bedside with the patient, we are the healthcare provider that is mostly with the patient. So what do? We identify problems. We suggest improvements. We participate in the pilot intervention. We collect, we analyze data, and we advocate for safe and quality care for patients. In this slide, basically this is just a visual representation of the Deming cycle as a continuous loop. So as we mentioned earlier, this cycle is a continuous cycle. If your intervention doesn't work, then you are going to go ahead and restart the cycle all over again, and the cycle will continue until the intervention is effective. Each cycle is going to build on lessons learned from the previous cycle and encourages interactive testing of small changes rather than large changes, one modification at a time. For the Deming cycle, how does it relate to safety accreditation standards? So, for example, the Deming cycle aligns with Joint Commission's patient safety goals. It also supports nursing education framework like AACN Essentials and demonstrates compliance with national quality improvement initiatives. In conclusion, the Deming Cycle provides a simple but powerful framework for continuous quality improvement. It helps nursing teams improve patient safety, enhances quality outcomes and teamwork by applying evidence-based changes in a systematic way. These are my references. If anyone has any questions, please feel free to reach out to me. You can send me an email, and I will be happy to answer any questions that you may have. Thank you so much for your time and attention, and have a nice day.